Well, thank you so much, Dr. Wells, for being with us today. We are so grateful for you to share your knowledge about the community and especially your perspective and your point of view and what you see in your role, not only with AHA as a volunteer leader, but also with the school district and your vast network there in your Region 4 role. So if you would you introduce yourself and tell us how you've become involved with AHA?
Sure. Thank you so much for inviting me. As you said, my name is Pam Wells, and I serve as the Executive Director at Region 4, and I have the honor of also serving on the AHA board. I think when I joined the board, one of the things I was most impressed with was the focus on the social determinants of health, because those are exactly the same determinants for a successful student. So as an educator, I was so pleased that that was the focus of the work of the AHA.
Well, thank you. We certainly value your perspective and rely on you a lot as a thought partner in a lot of our community work. On that note, we would love to talk a little bit about our community impact work at the AHA and kind of how that's relevant with the current needs right now in Houston. In your role with Region 4 and in your vast experience with school communities, what needs have you seen emerge in the community?
So I think even more so with the pandemic, the issue of equity of education for children is such a huge issue. And a lot of that has to do with connectivity as well as health and safety. But I think the thing that keeps me up at night the most is the issue of food insecurity. We have about 45,000 children, at least, in our Region 4 area who have not shown up to school. They're missing students. And we have about half of the students, about 50% of the students, who are actually learning virtually. Many of these children ended up getting food, sometimes 3 meals a day from their school. And so now they're really not able to have that, and the food insecurity has increased so much. The schools still have that food available, but it's very difficult for families to get there when their children are not riding to school. So the whole issue of food insecurity, to me, is one of the greatest challenges for families and for our community.
So thank you so much. I know that some of our reliable sources nationally are stating that food insecurity is essentially doubled as a result of the pandemic. So hearing you say that is both sobering and meaningful in terms of the work we could be doing in communities. You've been really working closely with my team, and we're so grateful for that partnership and for your leadership. And we would love to hear from you today just on a few of the ways that AHA has been involved in addressing some of those needs that you see.
So there are many more examples than I have time to be able to share, but I'll share just a couple of them. Recently, we were so pleased that in Deer Park ISD, the AHA provided not only 30 CPR kits for utilization in the schools, but also created some watering stations. And this was not just important so that students could have healthy choices for what to drink, but it also helped the health of the environment so that children were not drinking sweet drinks and utilizing those plastic bottles as well. In addition, in Conroe ISD, there were hundreds of boxes of fresh food, fruits and vegetables that the AHA helped to distribute. And for children who have food insecurity, for families, we know that fresh fruits and vegetables are critical when they live in food deserts. So pleased about the work that was done in the schools there. And of course, the Third Ward initiative that the AHA is working on, which is not just in the Third Ward, but in other parts of the community too, to not only help with fresh fruits and vegetables, but even to help with the work that is being done to help people learn how to cook and how to provide for themselves, especially those who have diabetes. So appreciative of all the work that the AHA is doing, and each of the things that are done to help families in our community help the children who are part of those families.